Hi, I'm Sohali Khan. Welcome. Imagine this: flakes falling every time you touch your hair, or your favorite black outfit turning into an embarrassment. Yes, I'm talking about dandruff, the silent villain on your scalp, feeding on oils and wrecking your confidence. You've tried it all: curd, lemon, oils, OTC shampoos, but it only gets worse. Well, don't panic, because today we're uncovering the truth with insights from a dermatologist to guide you to a healthier scalp. So let's get started. Welcome, doctor, and thank you for joining us. So, doctor, many people think that dandruff is just dryness or a cosmetic issue. Is it really that simple?
So dandruff is not just dryness. Dandruff is actually prolonged shedding or excessive shedding of superficial layer of skin over the scalp. It is most commonly seen in the age group of 15 to 17 years, that is pubertal and post-pubertal age, in both boys and girls. It is more commonly seen in males as compared to females, and half of the world's population undergoes through dandruff. So it has various etiology. The most common cause is the Malassezia. It is a fungus. Commonly it is present on our scalp, but due to some underlying conditions or due to some triggering factors, it becomes excessive, like suppose due to sebum secretion during the pubertal age. This Malassezia fungus grows and it causes lipase, that is, it causes breakdown of fat to fatty acids, and these fatty acids then they cause irritation of the scalp, leading to dandruff. Second cause, as we know, is the decrease in immunity, and third cause is increased cell turnover, that is, in some diseases the cells on our scalp, instead of formation in 1.5 months, they get formed every 8 days. Due to that, the dead skin layer increases and that leads to dandruff formation. In addition to this, some vitamins, vitamin B, pyridoxine, all B complex vitamins, deficiency of these vitamins, that may also lead to dandruff.
Now that we've understood that it's not just dryness, doctor, please tell us when and why people suffering from dandruff should seek medical consultation.
So as I said that dandruff can be mild, 1 or 2 flakes, or it can be severe, that is severe itching along with redness. So if it is mild, we can manage it, but when after application of anti-dandruff shampoos also we are not able to get rid of this dandruff, or it is recurring again and again, then it's the time to visit our skin doctor or a dermatologist. So let's see what are the few conditions in which we can get this recurrent dandruff. First of all, let's see in females, that is PCOD. This PCOD means polycystic ovarian disease. In this condition, there is a hormonal imbalance. Mostly the female is fat. Sometimes lean PCOD is also there, but mostly 90% of cases it is fat. And then there is hormonal disturbance, irregular menses, there is hirsutism, that is abnormal or excessive growth of hair on our body as well as face, there is hair loss over our frontal scalp, and there is dandruff. So this is PCOD or PCOS. In this case, there is recurrent dandruff or stubborn dandruff. Second condition is seborrheic dermatitis. In this condition, there is severe itching and redness over the scalp. Along with the scalp, seborrheic dermatitis involves our eyebrows, our skin behind the ears, besides the nose, below the lower lip, as well as our chest, armpit and pubic region also. There is itching and redness in these areas also. So here we require consultation from our dermatologist. Third is scalp psoriasis. In this condition, as I already told you, the turnover of the cell increases. That is, the cells, instead of getting replaced every 1.5 months, they get replaced every 6 to 8 days only, and that's why thick layer of dead skin is formed, and that causes flaking and itching. So it will require dermatologist opinion, some tablets, shampoos, and a long course of treatment, which we cannot solve this at our level at home. And fourth condition is tinea capitis, that means fungal infection over our scalp, like we get fungal infection on our groins. So likewise there is fungal infection on our scalp, and that is seen mostly in children and those who have lowered immunity. So that also requires antifungal oral tablets as well as shampoos and a prolonged course. So these are some of the conditions in which we should consult our dermatologist.
Doctor, why is it that most of the home remedies fail to treat dandruff? Why is dandruff so stubborn? And why do these quick fixes not work?
Yes. Now we know that dandruff is multifactorial. We already know some of the reasons or the underlying conditions behind this dandruff. So unless and until we treat these underlying conditions or the root cause of dandruff, this dandruff won't go. That's why we see or the patients complain that they have tried everything, all types of products, home remedies, still it's not going, because the underlying disease has to be, first the dermatologist will examine you, he will tell the diagnosis, and then he will treat that condition, and the dandruff will be automatically it will get removed. So in addition to these anti-dandruff shampoos, there is a lot besides this. Suppose it is PCOD, then lifestyle matters. It is a lifestyle disease. Similarly, psoriasis, scalp psoriasis, as well as seborrheic dermatitis. All these three diseases, they are lifestyle diseases. In these diseases, the most important thing is diet, exercise and stress reduction. So these patients have to do, and then only we will get rid of this recurrent dandruff.
What is the key takeaway for managing dandruff?
So you should seek early consultation from your dermatologist, and you should follow the course told by your dermatologist. That means incomplete treatment should not be there, because certain diseases are there which are long term or chronic, like seborrheic dermatitis or scalp psoriasis or PCOD. They are off and on. That means sometimes due to stress or in winter it can increase. Like in children, they can increase during their exams, but otherwise the dandruff can be under control. So when it is more, you have to consult your doctor. He will give you tablets, creams, and when it is less, then once a week application of shampoos, anti-dandruff shampoos is okay. So like this, you have to learn how to manage this condition. You have to learn what has happened to you and how you can manage it under guidance of your dermatologist.
What should people do to maintain scalp health?
So scalp health is very important during summer season, and those who exercise daily, they have a lot of sweating over their scalp, so they should wash their hair daily, and with anti-dandruff shampoo they should wash at least twice or thrice weekly. While washing our hair, what we should do, we should wet our hair and then apply normal mild shampoo to our hair and apply anti-dandruff shampoo only on the scalp. Wait for 3 to 5 minutes and then rinse with water. Next, we can apply conditioner on our hair only, not on our scalp. So this should be the usual method of washing our hair. Second thing is the good diet. Having healthy diet rich in omega-3 fatty acids, zinc, selenium. That is, you should consume fish or other vegetables, fruits, sprouts, salads, etc., and avoid all kind of junk food, sugary or salty food. Oily food you should avoid. Third is the regular exercise along with meditation or mindfulness. You should decrease your stress level. You should also avoid excessive use of hair dryers because that causes more dryness, and you should avoid OTC products because every scalp is different and there are a lot of agents for removing the dandruff. Some are keratolytic, that is they decrease the formation of rate of formation of skin. Some are antifungal agents, so the doctor will only tell you which shampoo you require, and you should avoid excessive use of hair gels or cosmetics which are not suitable for your scalp.
So dandruff isn't just about flakes or itching. It signals underlying issues like seborrheic dermatitis and acne. Don't wait for dandruff to spiral out of control. Consult your dermatologist and find a solution individualized for your scalp. Your dermatologist knows best and will help you to stay flake-free and confident. Your scalp, your story. No shortcuts, just expert care.